Afternoon. Thank you so much for joining us today for the BCCSU's first Research and Dialogue Speaker Series of 2026. Normally, I would give a few minutes for people to get settled, but as we're starting a little late today, I think we'll jump right in. I do want to let everyone know that we are recording the speaker series today, so do please feel free to turn your video off if you would like. Um, I guess I'll provide an introduction for myself. I'm Amanda Everall. I'm the Knowledge Translation Coordinator for the research group here at the BC Centre on Substance Use. Um, and I guess as we're getting started and getting settled into this webinar today, I do think it's really important that we get started off in a good way. So we would like to acknowledge that myself and the presenters today are joining you with gratitude from the unceded traditional and ancestral territories of the Coast Salish peoples. This includes the traditional territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. And the reach of the work that we do here at the BC Centre on Substance Use touches the territories of all 198 First Nations in BC. I also think it's incredibly important to take the time to recognize today that the ongoing criminalization, institutionalization, and discrimination against people who use substances does disproportionately harm Indigenous peoples. Very quickly today, I'm going to go through a couple administrative items before I provide an introduction for today's speakers. As I mentioned, we are audio recording this and video recording rather this webinar, so do feel free to please turn off your video if you should wish. I'll also note that we have muted all attendees for this webinar. When it comes to the question and answer, if you have questions, I can unmute you at that time, or you can use the chat box. We'll be starting the presentation with an overview of research findings and a presentation by Erica. This will be followed by our response, placing the research in the real-world context. I'd also like to quickly mention that today's webinar is scheduled to end at 1 o'clock. However, as we're starting a little late, our presenters have graciously agreed to stay a little longer if needed for the question and answer period. And with that, I'm going to get started with our introductions. So Erica McAdams is a white settler who was raised on the traditional and unceded territories of the Algonquin Anishinaabe people in what is colloquially known today as Ottawa, Ontario. She currently lives and works on the unceded and stolen lands of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. Erica has a master's in public policy and is currently a PhD candidate at the University of British Columbia. Her CIHR-funded doctoral research evaluates the impacts of innovative policy responses to toxic drug crises among young people who use drugs, including the Decriminalization Pilot Project, as well as prescribed safer supply. Callie is the lead Indigenous Collaborators Circle that informs the research priorities of VIDUS, Access, and ARISE cohorts. She's been a longtime collaborator with many scientists at the BCCSU and brings over a decade of lived and professional experience working with communities impacted by the toxic drug crisis, with a strong focus on advocacy, policy change, and community-led research. They have many other roles in the community, including currently being the ED of Coalition of Peers Dismantling the Drug War on Advocacy, an advocacy-based organization rooted in Vancouver's downtown east side. And then lastly, but not least, Carmen is joining us today, and she has been contributing to the research and publications for the BCCSU since 2014. She focuses on youth, women, and public policy surrounding harm reduction. For the past 2 years, she has led the team of community research associates at the ARISE cohort and has most recently started as a peer educator for Vancouver Coastal Health, co-facilitating clinical workshops for medical and community frontline workers. And so with that, we can get started. Erica, please take it away.
Thanks so much, Amanda, for those introductions. I'll just share my slides. Just give me 1 second. Okay, does that look okay? Great. Okay, thank you so much, everybody, for joining today. I'm sorry we're starting a bit late. We'll probably go 10 minutes late, but I can try and skip some slides to catch up on time. So in case for folks that do have to leave right at 1 p.m. So I'm really excited to be talking about decriminalization today with Colleen and Carmen. This was, as you all know, a very controversial policy, and we're going to help try to make some sense of the narratives and some of the evidence around decriminalization. So here's just a brief overview of what I'm going to speak about today. So I'll just start with some really brief background information about Decrim in BC. Then I'll spend some time going over the policy objectives, and then going through some of the early evidence to paint a picture of how we think decriminalization performed based on very early indicators. And then I'm hoping we'll turn to my wonderful co-presenters and have a panel discussion about the unintended consequences of decrim and those prominent critiques that we heard so loudly in the media, and also how decriminalization actually felt on the ground, so to speak. So here's a brief timeline of decrim in BC. So the exemption that the province applied for to have an exemption from the Controlled Drug Substances Act was applied for in May 2022, and it was approved by the federal government. And as you all know, decrim started in January 2023. Shortly after, there started to be emerging concerns about potential increases in public drug use. And so there was a First Amendment made to the exemption that prohibited possession within 15 meters of pools, parks, and other outdoor places. But again, those concerns kept spreading, and they're consistently were mentioned in media. And as a result of this public and very political backlash, what we saw was the government of BC put forward Bill 34, which was called the Restricting of Public Consumption of Illegal Substances Act. And this was really to criminalize public drug use as a response to perceived increases in use. What we saw right after that was that the Harm Reduction Nurses Association was successful in getting an injunction to temporarily suspend the act from coming into effect. But all while that was happening, unfortunately, the province actually applied to Health Canada to have the decriminalization exemption essentially revised to only apply in private settings. So it only applied to a very specific amount of private settings, and that started in May 2024. So all in all, essentially, I would argue that we only had decriminalization in its truest form for 16 months in BC. And as you all know, decriminalization, what was left of the pilot, just ended this past January. So the evidence that I'm going to speak about today is really focusing on this first 16 months, given that that is when the truest form of decriminalization was active. And these are just the brief characteristics of the BC model for those who are not aware. So it only applied to a very specific range of substances. We used a cumulative threshold of 2.5 grams to define personal possession. There was no police seizures allowed for personal possession, and it applied to adults 18 years of age and older. So before I go into the evaluation research, I just want to spend a few minutes kind of laying the groundwork to talk about the objectives of decriminalization in order to ground our discussion about what decriminalization could actually achieve. It's really important to know that decriminalization is a very small intervention. It does only one thing. So it really just removes criminal penalties for simple possession under the Controlled Drugs and Substances Act. It doesn't regulate drugs, doesn't expand treatment, doesn't address homelessness, on and on and on. And because it's so narrow, what it actually can achieve and the outcomes that are feasible and realistic are also very narrow. So there are three key objectives of decriminalization. So the first one is to reduce contact with the criminal legal system for people who use drugs. And this is really the first immediate and most measurable objective that we would expect to see progress on almost immediately after the implementation. So essentially, theoretically, if possession is no longer a criminal offense, we'd see fewer police interactions, charges, and interactions just in general with the criminal legal system. The second objective is to reduce police drug seizures for personal possession. So if personal possession is no longer criminalized, police should not be confiscating drugs that fall within the threshold quantity. And this objective really it encompasses the shift away from understanding of punitive enforcement measures to more of a health-oriented approach. And so both of these are considered to be short-term mechanistic objectives, and they're the direct policy levers that decriminalization can impact. And so the last key objective and central objective of decriminalization is to reduce stigma against people who use drugs. And this is really that broader cultural objective. So essentially by removing criminal penalties, decriminalization signals that substance use is not a criminal issue or a moral failing. But again, it's really important to note here that reducing stigma is going to be a long-term process. It requires time, it requires supportive government messaging. So we would not expect to see dramatic changes in stigma over a 16-month pilot project. And so this is the list of objectives that the BC government included in their decriminalization framework. So we have a whole host of different things, from reducing drug poisoning events to reducing stigma to improving interactions with police. And I just want to pause for a moment and highlight that these are essentially way too many objectives and essentially outside of the scope of what decriminalization can achieve alone. Many of these objectives require other policy interventions. And I really want to drive home the point that decriminalization is not a panacea. It's not going to solve all of the problems in our society related to drug use, and it's a very small intervention. It's just designed to separate people from the criminal legal system. And I also wanted to highlight that reducing drug poisoning events and deaths, and overdose deaths, that should not be framed as a key objective of decriminalization, given that there's no mechanism within decriminalization to substantially reduce overdose deaths, because it doesn't target the root cause of the overdose crisis, which is the unregulated toxic drug supply. And so this is really the only key objective that decriminalization is designed to meet. Everything else requires other policy interventions like investment into healthcare, and we need other things to happen in order to make progress on these other objectives. An example of a secondary objective of decriminalization might be reducing barriers to health and harm reduction services. And this would be considered secondary because progress would be achieved through making progress on those primary objectives. And so this is the key conceptual point I'm hoping to make, is when we evaluate decriminalization and we talk about evaluating decriminalization, we must evaluate it based on what it's actually designed to do as a policy, not based on these broader societal problems that require entirely different policy interventions. And I think that this is really critical, given that how polarized this policy became and the widespread critiques that it received. So this slide just quickly visually lays out the objectives and kind of mechanisms of how decriminalization operates. So these would be our key objectives here. These are the two short-term, which are criminal justice system focused, and then reducing stigma, which is our long-term objective. And this is just an example of one of the secondary objectives, but essentially there's only two pathways in which secondary objectives can be achieved. So the first would be if, for example, decriminalization reduced police hanging out outside of harm reduction sites, then maybe that would result in reducing barriers. Or if decriminalization reduced stigma, then maybe people would feel more comfortable accessing these services and experience less stigma from the healthcare system. And so the key analytical takeaway I'm trying to get at here is that secondary outcomes can only be achieved through one of these two mechanisms: by achieving progress on reducing criminal justice system contact, or through reducing stigma. So anything outside of that, so when people attribute changes to homelessness or public disorder or overdose deaths to decriminalization, those are essentially conceptual errors and misunderstanding what decriminalization can actually do in practice. And decriminalization was never designed to impact those things. So when we talk about evaluating decriminalization, the key question that I want to frame our discussion is, did it achieve the objectives that it was actually designed to meet? And that framing, I think, is very important given how controversial it is. So now I'm going to talk through some of the evidence that we see evaluating decriminalization, but I'll go through it through the lens of our performance on the key policy objectives. And I'll use information from the Ministry of Health reports evaluating decrim, and also some peer-reviewed evidence. I'm not going to go through everything, but just some of the more notable findings. Okay, so for objective one, reducing contact with the criminal legal system, this is information from the Ministry of Health and their reports to Health Canada. And this data is from February 2023 to April 2024, before the reversal of decriminalization. And just want to highlight that this isn't peer-reviewed data. It's not adjusted for anything. It's just crude descriptive statistics. And so this chart details possession offenses and how they have changed over time. So we start in January 2019 over here, and then we end in April 2024 before that change in reversal of decrim. And essentially what we see is, before decriminalization, province-wide, there was an average of 718 charges a month. And then post-decriminalization implementation, we see that average drops to 165 charges. So that's a pretty substantial drop. There's clearly some criminalization that was still happening during decrim, given that that number isn't zero. And this could be for a range of different reasons, like different policing practices, still charging under the threshold or charging over the threshold, or exempting substances in exempted places. And using that same data, when we disaggregate it by health region, we essentially see that there's differences in the rates of charges by health authority. And you can see that the interior and northern regions both have the highest rates. So there is disparity within enforcement of decriminalization across the province. But I also wanted to show this graph as well that shows the interior and northern region. So it's the rates of drops, the declines over time. And essentially you can see that there was higher levels of criminalization within these regions and that they experienced the largest drops post the implementation of decriminalization. So this is suggesting that decriminalization had a larger impact in those regions because there was more policing occurring. Okay, so let's talk about peer-reviewed evidence now. So again, how did Decrim perform on that key policy objective of reducing criminal legal system contact? And so this is a study that was published in the International Journal of Drug Policy, and it assessed changes in incidents and charges for drug possession. And so incident just means a police interaction, and a charge is a formal charge laid by the Public Prosecution Service. And I'm not going to go through everything that this article did, but just touch on what's relevant for our discussion today. And so the authors used interrupted time series analyses modeling, and they used Statistics Canada data. And again, this is for the time period before decriminalization was reversed. And essentially what the authors found is that decriminalization led to a 52% drop in possession incidents, which is very significant. And this is really good insight to suggest that decriminalization was making progress on this primary objective. There's another study that assessed changes in offenses and charges for drug possession, but this time in one municipality in BC, so in Victoria, BC. Again, this is first year of Decrim, and they used Victoria Police Department data, so a different data source, and they used similar ITS models. And essentially what they found is that offenses and charges for personal possession significantly dropped actually before the implementation of decriminalization. And then after the implementation of decriminalization, that trend was flat. And non-significant. And so the authors talk about a few different reasons of why this might be. So when we think of charges, essentially charges before the implementation of decriminalization were essentially near zero. So given that the charges were already almost zero, there wouldn't be enough of a drop to detect statistical significance. And this is likely a result of anticipatory policing practices. So if police knew that decriminalization was coming into effect and there had been other sort of policy changes indicating that the government is less willing to prosecute personal possession, essentially we would have seen those drops before decriminalization, and that's what these authors document. So essentially the key takeaway from this study is that in Victoria, BC, we saw offenses and charges for personal possession decline, with the greatest declines happening before the introduction of decriminalization in the province. So collectively, this preliminary evidence that we just spoke about essentially shows or demonstrates that decriminalization was likely making progress on meeting this key objective of reducing contact with the criminal justice system. We can see that there's still criminalization clearly happening within the province, but overall it seems like decriminalization was making progress, though it wasn't perfect. So these are our key objectives again. So now let's talk about seizures. So let's start again with the Ministry of Health data. And so this chart details police drug seizures below the threshold of 2.5 grams. And again, we start in January 2019 and go all the way to April 2024. And so what we see is before the implementation of decriminalization, there was an average of 206 seizures a month. And after the implementation of decrim, that dropped to about 15 seizures a month. And again, this is a pretty huge drop. And as many of you know on this call, seizures cause a lot of harms, and they've been documented to increase overdose risk. So this seems like potential insight into something that's quite significant. But again, I just wanted to highlight that there's regional differences here. So this is data, I didn't have disaggregated data for the same time period as the slide before this one, but I did have disaggregated data for a few months before. And so essentially we see the same patterns with disparities in other regions in the province, so particularly in the interior, northern, and island regions. And again, same sort of pattern. Those regions had the highest levels of seizures compared to the other regions in BC before the implementation of decrim, and so they also experienced the largest drop. And again, I just want to highlight that we're not seeing that seizures dropped to zero. So I'm not suggesting that decriminalization was perfect. All I'm saying is that it was making progress and it did seem like there was declines, but there's clearly room for improvement. Um, Typically in policy evaluation, you would evaluate the policy in order to make changes to optimize the performance on how it's meeting the key objectives. But sadly, as we'll talk about, this really wasn't the case with decriminalization. It was reversed before it really was given a chance to optimize the benefits. And so now let's quickly look at some of the peer-reviewed evidence for police drug seizures. And so this is the same article that used Victoria Police Service data. And so they also looked at drug seizures and used ITS models. And they found that seizures did drop 59% during the time period of their study, which was January 2020 to December 2023. And similar to what we talked about with charges and arrests, it didn't achieve statistical significance because it was a general decline over time. So again, we think that there was anticipatory policing practices coming into effect. But what they did find was that there was a statistically significant change in the average amount of drugs seized. So and that increased. So essentially what we'd expect with decrim is if seizures under 2.5 are prohibited, we would expect that the average weight of seizures post implementation would increase. So this does give us suggestions that it seems like police were shifting away from enforcement and seizures of smaller quantities of drugs. Again, I don't want to say that this is a good thing. Seizures, any type of seizures, cause a wide range of harms, but it does provide us with insight into suggesting how policing practice might have changed under decrim. This is another great paper that it doesn't explicitly evaluate the impact of decrim on seizures, but it did look at correlations between seizures and the changes in the unregulated drug supply. And the author used VPD seizure data obtained through an FOI request. And essentially they document that seizures still seem to be common practice in Vancouver after the implementation of decriminalization. But there are lots of limitations with police seizure data, unfortunately. The VPD data isn't attached to charges, so we don't know if these seizures were for personal possession. We also don't know the quantities. So we have indications of what we think happened, but we don't have a clear picture yet. It's important to also note that the impacts that decriminalization would have on police drug seizures really is constrained by policing practices in general. So for example, in Vancouver, we have documented evidence that police drug seizures happen without arrest and documentation. And there's lots of limitations with the seizure data that is available for researchers to use. We expect that it underestimates the true scope of seizures, given that there's issues with documentation, and that they might not be all seizures might not be formally recorded. So we know that provincial reports and data sets from police don't fully capture the range of seizure-related harms, but hopefully we'll know more information as more peer-reviewed published literature is published. But all of that to say, preliminary evidence suggests that decrim likely did reduce police drug seizures, but we're not sure about the extent and the variations of impacts in different jurisdictions. So just stepping back for the three key objectives. So we have evidence to suggest that decrim is performing well in the first two, so reducing contact with the criminal legal system, reducing police drug seizures, but there's still room for improvement. But we have indications to suggest that good progress was made within the 16 months that it was active. And then in terms of stigma, we wouldn't expect to see measurable changes over such a short period of time. We've been operating in a state of prohibition for over a century, so a 16-month pilot project is just not long enough for us to see shifts in deeply embedded societal stigma. There is a study conducted by Ali et al. That found societal, structural, and self-stigma remained pervasive post-decriminalization among people who use drugs. And again, that's not really surprising. It doesn't indicate that there's a failure within decriminalization. It just really reflects the fact that stigma reduction is a long-term objective that requires a full cultural change. And so now I'm just going to talk about one additional objective, so a secondary objective of reducing barriers to health and harm reduction services, given that this was such a focus of the province's plan for decriminalization. And so this is a study that we recently published evaluating impacts of decriminalization on police acting as a barrier to accessing harm reduction services among young people who use drugs. And Collie and Carmen are both co-authors on the study and helped develop it. And so we used data from the At-Risk Youth Study, which is a prospective cohort study of street-involved youth. It was established in 2005. And essentially, when participants enroll in Arise, they complete interview administered questionnaires every 6 months. And so the study period for this was June 2021 to May 2024, again, before the reversal of decrim. And we used GEE models to understand if decriminalization had an impact on reporting police barriers. We also did a sub-analysis among Indigenous participants as well. And given the disproportionate harms that Indigenous folks experience, disproportionate targeting by police. And so Arise works with an Indigenous Collaborators Circle that is led by Kali, and it includes 6 individuals that have Indigenous ancestry and lived in living experience of substance use. And the circle meets on a regular basis to guide the activities of Arise, and it really helped design and implement this study and help guide the decision to conduct the sub-analysis among Indigenous participants. And so the main outcome that we used in this study was based on this survey question. So we asked participants in Arise, in the last 6 months, has police presence near a supervised consumption, overdose prevention, or drug checking site prevented you from using this facility? And so when we look at the descriptive data over time, what we can see is that there was a slight increase in participants experiencing police barriers before the implementation of decrim. And then we could see that there might be a slight downward trend. And so we wanted to see, like, were these changes statistically significant? So we ran a GEE analysis that adjusted for a range of confounders. And essentially what we found is that before decriminalization, there was a statistically significant increasing trend of participants in Arise experiencing police-reported barriers to harm reduction services. And that was an average of 141% per year. So that's very significant. And at the implementation of decriminalization, we observed a significant level drop in participants reporting police barriers. And so the level drop is about 65%. And then after the implementation of decrim, we essentially saw that really statistically significant increasing trend was halted and the trend became flat. And so this is the data among participants who identify as Indigenous. And essentially what we see is very similar to the analysis of all cohort participants, but a bit steeper in terms of the trend. So before decriminalization, we see a bit of a steeper trend. And after the implementation of decriminalization, we see a steeper decline. And again, when we modeled, we found that before the implementation of decriminalization, the rate of police barriers was increasing significantly, so 144% for Indigenous participants. And then at the implementation of decrim, we didn't see a level change like we did in the analysis of all cohort participants. But what we did find was that after the implementation of decriminalization, we saw a change in the trend over time. So essentially, on average, there was a declining trend of 72% per year in participants experiencing police barriers. So just in summary, what we saw is that before the implementation of decriminalization, there was a significant increasing trend in people experiencing police barriers. So this is both for the entire cohort and for the Indigenous subsample. And then at the implementation of decrim among all cohort participants, we saw a level drop. And then after the implementation of decriminalization, that increasing trend was halted and essentially became flat. Whereas in that sub-analysis among our Indigenous participants, there was a declining trend over time that was significant. So this is kind of our interpretation. So what does this all mean? So essentially, what we see in this drop is that it could be a few different things. So the first thing could be that it's possible with decriminalization that police stopped focusing on street-level drug use and street-level use. So essentially, we have evidence to suggest that police are really influenced by the actions of prosecutors that have been directed to not pursue charges for simple possession. So maybe they stopped hanging out around safe injection sites and overdose prevention sites. Another possible interpretation is that police presence at these sites remained consistent, but participants didn't perceive them to be a barrier because of the protections afforded by decriminalization. Again, this is potentially less likely given that there's a long history of police violence and injustice towards people who use drugs, particularly Indigenous youth who use drugs. But yeah, perceptions as police of a barrier really depends on a person's lived experience and experiences with police, and it's shaped by their past interactions with the policing system and the intersections of their individual social locations. We do have qualitative research from the study setting. So in Vancouver suggests that people still did see police hanging around outside of OPSs, and that's not in contrast to our findings. What we found is that there declined, but it wasn't a decline to zero. So it was still likely that police were outside of safe injection sites. But our analysis is essentially saying maybe that declined, or it was the perceptions of people and didn't see police as acting as a barrier anymore because of decrim. It's probably a combination of those two things. So overall, the findings of this study indicate that the implementation of decrim was positively associated with impacting a key policy objective to reduce reported barriers to harm reduction services in Vancouver. And this is really meaningful given the decades of substantial research evidence documenting the harms associated with police being outside of these sites. We also observed a significant declining trend among Indigenous participants, and this is noteworthy given the greater harms experienced by this group given historic and ongoing criminalization and systematic racist police violence. Okay, so I'll just wrap up here. So to bring it all together, so essentially early evaluation indicators suggest that decriminalization was performing well on the key objectives it was designed to influence. Doesn't mean that it was perfect. There was clearly variation across regions and disparities in different regions. And there was also clearly implementation challenges. But from a policy evaluation standpoint, it did seem like it was making measurable progress on influencing its primary objectives. More evidence will continue to emerge as we have additional peer-reviewed research is published. And right now, this was just early evaluation stage data. So we'll start to get a clearer picture as we know more. Decriminalization was only active for 16 months. So again, I just wanted to highlight that we're not going to expect to see huge changes on those long-term objectives like reducing stigma within that time frame. And this is probably the most important takeaway I hope you leave with today is that decriminalization is a very small intervention. It was never designed to fix homelessness. It wasn't designed to eliminate public drug use or even solve the toxic drug crisis. It was designed to separate people who use drugs from the criminal legal system. And when we evaluate policies against outcomes they were never designed to achieve, it's going to look like they failed. In public policy, when early evaluation shows that we're making partial success and we have implementation gaps, what we would hope is happen is that the policy would be revised and be optimized to like so it could best meet its policy objectives. But unfortunately, what we saw is that this policy was abandoned before the full effects could have been achieved. So I don't want to argue that decriminalization was flawless. All I'm arguing is that it should be evaluated and debated, and it should be based on the evidence and on the objectives that it was actually designed to meet. So now, with that evidence in mind, I'm going to turn to my co-presenters now, and we'll have a discussion about some of the critiques of decriminalization. So we want to talk about like how those critiques emerged, how were they framed publicly, how they contributed eventually to the rollback of the policy and the pilot ending. Yeah, and so I think that kind of the key question for us is, you know, if the policy was making progress on the goals that it was supposed to impact, why did it become so politically unattainable? And what were those dominant narratives that were influencing that? I'm just going to switch my slides for a second. Let me know if you can still see those okay. Perfect, thank you. Yeah, so I think a really good place for us to kind of start off is talking about the prominent critiques of decrim. Yeah, so Colleen, Carmen, are you ready to jump in here? So we wanted to talk
Yeah,
about some of the reasons why decriminalization was eventually reversed and the reasons why it wasn't extended.
I think the biggest one was just the fact that there was a lot of chaos around public use and public disorder, but that wasn't like the true case because it was just propaganda, but also fear mongering around the fact that there was a lot of like increased public drug use and also overdoses and stuff, and that wasn't the case at all. It's just like it didn't have time to fester because they really went like with Health Canada or with the BC government going over and going straight to the health minister in Health Canada to get public use um in there. So it's pretty much decrim and then recrim pretty fast. So it was never had the time to like even like fester or even allow it to saturate into the community really.
yeah, agreed. And our government, is becomes so susceptible to um, those loud community voices. causing them to flip-flop so quickly on things that they once, were so behind, and champions for the community, and supportive of, our high risk populations. And it's funny that you showed the data, how the seizures were pretty much consistent across the board, the decrease. And it's, on the island, even you said, and some of the loudest voices against things like decrim, and supporting that fear mongering um, attitude surrounding harm reduction and drug use come from the island as well. And yeah.
And another thing I think that really critiqued it was just the fact that it was during a really political time when we had a new John Horgan was stepping down and stuff like that, and it was just yeah, people used it to gain votes by being like, well, swap this, like look at what Evie's done now with like involuntary care and stuff like that. It's been a big thing, and then also just um like or we had benzos come in when COVID happened, and now we're having the issue with tranquilizers and other sedatives that are causing a lot more issues in the drug supply. And it's just just easy things like that, but also just it was a very political move that David Eby used for this too.
Totally. Those are
Exactly.
such
And
great. Go
yeah,
ahead,
through
Carmen.
my
Sorry.
sorry, it's okay. Through my experience as well, even trying to do something like have some local politicians support at an overdose awareness day event, where these representatives are happy to speak to you on the phone and talk to you about how proud they are, that you're doing this and that for the community, happy to support this and that. But to get them down there in person to take a picture, they're they're not, in their own words, they're not dumb enough to show their face actually, in person, shaking hands with us, as as figureheads in the harm reduction community. They think it's political suicide
Yeah.
at
It's
this
been
time.
so yeah, it's been so upsetting to see how polarized these narratives have become. And Cole, you brought up a great point about David Eby because that was during the election time and he was getting hammered on decriminalization right before the election. And so what they decided to do was just reverse the policy. So then they couldn't be critiqued on decrim anymore. So people would be like, decrim isn't working, decrim caused overdose deaths, blah blah blah. And their response is essentially like, well, we don't have decriminalization anymore in the province. So it was such a shame to see that it really wasn't given the opportunity to really, make progress in the ways that we were hoping. Um, Something you also brought up, Collie, was talking about public drug use. And so we don't have good evidence to tell us one way or another if public drug use increased or not. But what we do have is evidence from Statistics Canada looking at rates of charges for disturbing the peace. So disturbing the peace can be seen as kind of a catch-all charge that the police have available for them to use. Um, and essentially, what we see when we look at Statistics Canada data is that rates of disturbing the peace remained consistent, and if anything, actually declined during decriminalization. So we don't have good evidence about public drug use, but we do have some evidence to suggest that rates of disturbing the peace didn't increase. Um, Something else that we talked about was how decriminalization was being blamed for a whole host of societal ills. So, Collie, you brought up benzos in the drug supply. Do you want to talk a little bit about how benzos are affecting the community?
Yeah, like with like COVID really affected a lot of people with the fact that we have a lot more people on the streets now, but it's also just with the drug supply now being contaminated with benzos and now tranquilizers, but benzos caused a lot of issues where people like heavily sedated people, so like they weren't having a toxic drug poisoning, they were just dealing with the fact that they were heavily sedated for long periods of time. So like it'd be having we'd have to switch our response to those toxic drug poisonings, and Yeah, the benzos now with tranquilizers, it's very different because it's they're knocked out for sometimes 6 to 12 hours, and it's just trying to figure that out. But also just people are using the supply, not knowing what they're having, and just like yeah, getting heavily sedated, and it's becoming more and more of an issue. Of just like you're seeing a lot more people sleeping and stuff like that, but also just the fact that there's when you're heavily sedated for a long time, you deal with a lot of like memory loss and stuff like that. You don't know what happens when you wake up because you just kind of go out and it's really can be really scary for a lot of people and stuff like that. So, and its drug supply is just getting more and more contaminated as the years go on, it seems.
Yeah, yeah, exactly. And I think a lot of what people perceive to be changes in, like, quote unquote public disorder is actually very reflective of changes in the drug supply, and the toxicity of the drug supply. When we talk about things like public use, the root causes of public use is that people don't have access to places to use drugs. The key root causes are lack of access to safe injection sites and overdose prevention sites, and a lack of access to housing. So if the government was serious about uh, stopping public drug use, they would be looking at housing and they would be fixing the housing crisis. But that's a lot harder policy to deal with and intervene with. So it's a lot easier to say, well, decriminalization caused it. Let's just get rid of decrim. That's a win for the government.
And the overdose prevention sites not having access to inhalation because a lot of people are smoking drugs now. So it's like there's a lack of spaces for that. Like the government tries to praise and say that they've opened up a lot more spaces when they actually haven't. Like there's been a lack of spaces for overdose prevention sites and other things, and they've also made it more difficult to open them because it's just they put barriers there, and then it's just also funding is a big issue. With another thing, it's just like a lot of funding now has been pushed really towards treatment and recovery, which is important, but it's also the lack of funding for harm reduction places is just really starting to really show now because it's just a lot of places are losing funding and stuff like that.
Yeah, it's been really hard to see
Yeah.
the changes in systematic defunding. Did you want to jump in, Carmen?
Oh yeah, I was just gonna say there definitely needs to be you know, more of a push to, address, safe inhalation spaces as well. Because it's true, the amount of people who are using needles um, when it comes to their opiate use, if they're using the unregulated supply, has dropped significantly, uh, like something like 75% or something like that. And people are opting to smoke, and
I think we've
yeah,
lost
if we
Carmen.
don't have safe inhalation associated with that.
Carmen, do you mind repeating the last little bit of your sentence? I think we lost you there for a second.
Oh, sorry. What part did you miss?
You're talking about the shift
Um,
from ejection to smoking.
oh yes, sorry. Yeah. So I said that the amount of people who are using needles to use opiates, the unregulated supply has dropped by like 75%. So we need to address that by opening safe inhalation spaces as well, because if we don't have that, those people are.
Oh no. Are you there, Carmen? Okay, we got you now.
Yeah, 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 yeah.
Yeah, those are such great points. I'm thinking maybe we should move on to our next question. So essentially, I'm curious to hear if you felt like decriminalization actually meaningfully changed interactions with police.
No, shouldn't like just because like it's having police give you a card with in like health info on it that's kind of outdated and stuff like that. It's just ridiculous a way to do it. But also just I find that like with right now in Vancouver, anyways, we're dealing with FIFA, and it's just like we're seeing a big police increase right now, and we have a lot of like people coming from different places where it's just creating a bigger issue because it's now we have a bunch of rookies that are coming out of just the Academy of RCMP and just like wanting to make a name for themselves, and so yeah, it's just like yeah, decriminalization never really like police wanted it, and we're saying that it's a health issue and stuff like that, but they never actually really did implement that. Like as soon as we had when we had decrim and then recrim, it just like you saw these pictures of them doing big busts, but when that wasn't actually the case, it was them um jacking up multiple people and then taking their drugs and then saying that it was a big bust when a lot of times it wasn't. It was just like they took it off multiple people over a certain period of time or whatever. And a lot of times they weren't very big busts. It was just like small amounts at the same time.
Yeah, thanks so much, Polly. Carmen, did you want to jump in here? Oh no, I think we lost Carmen. That's okay. Um, Yeah, and I think this was a point that I made in the presentation was like all of these things are going to be restricted by the culture of policing. So decriminalization does nothing to change the culture of policing. It just removes a charge available for them to pursue. So unless there is accompanying changes in policing about how they see people who use drugs and how they treat people who use drugs and people with marginalized identities, then we're not going to expect to see massive changes. Did you want to jump in, Carmen? I'm sorry.
Yeah, I even, the police chief, Steve Wright, he was interviewed regarding decriminalization in January, and he said this, um, that decriminalization was unsupported by sufficient investments in prevention, drug education, access to treatment, and support for appropriate enforcement, and it created unintended harm for the Vancouver community. That's from the police themselves. Uh, so the police, knew that the impact of this policy was, you know, tedious, or not tedious. It was on thin ice. It could have tipped at any point, and nobody was equipped to enforce it or roll it out. It really required a little bit more fine tuning, and even the police knew it. But I think that there were certain benefits for the police that maybe um, served the public a little bit, in that when they couldn't go after people who had small amounts of drugs on them, they then put a little bit of an investigative effort into going after people who had larger quantities. And of course, large scale drug busts also affect the supply and etc. So um, it's a big cycle.
Mhm. Yeah, and I think you allude to a really important point there that I think we could talk about our last question and then maybe we'll go to the Q&A. But essentially is like what should have been done differently? What about decriminalization wasn't working or the scale up of other things around the same time? Um,
I think like a big thing that wasn't allowed to fester was just like how they kind of backdoored it and went to Health Canada right away to get recrim, like public use made illegal, and or like public use being made illegal. And that's why like our a bunch of drug user groups came together and did a judicial review on that, because it's just we wanted like, and even Canadian Association of Nurses of Harm Reduction also managed to get it what do you call it, in court, and they managed to get it paused for a bit, which was nice. But it's just decrim is still is important because it's just it allows for certain things to happen, but it's also it wasn't able to be meaningful. And also the fact that a lot of times the meaningful work they did with engaging people who use drugs was just not done properly. Like I sat at a table for a bit, then I got kicked off the table because apparently I got too political. But it's just this is a political matter, but also it's just like engaging with people who use drugs and that are currently using drugs, not people that are not like not currently in the world and stuff like that, but also including different just different avenues of people that are using drugs and stuff, but also just like meaningfully engage with them and actually collaborating with them and going to communities and stuff like that instead of doing it all online and stuff. And so, and it just would be better if they, yeah, were able to do it in community instead of just doing it all online, where a lot of people have barriers to accessing things online and stuff like that.
Yeah, there really should have been a larger collaboration of people from all walks of life, taking hints from countries that have that already have these systems in place. What did they do to roll it out? What did you know what were their kind of key uh, the 3 or 4 things that they needed to address, and the most important things. And you start there. You start with the health authorities. You start with the police. You know who this is going to affect. You off the top of your head, common sense, you can think of what are the key things that are going to be most affected by rolling out a policy like this. And you get those people together, and you think of contingencies, and you think of um, all the supports to put in place. It's like a hot air balloon, you've got to get it in the air, but it's also got to land at some point, and got to balance it out.
Mhm.
Um, we really, yes, of course, and people who use drugs, peers with, or people with lived or living experience, should also be consulted, because we are the ones with the eyes on the community. If we're continuing to just uh, seek counsel, or create these policies um, with people who are the people who write the books, or doctors and this and that, we're going to have the same issues that we had before, before we involved people with lived experience in our research. It's going to be hypothetical. It's going to be it's going to be very limited, and there's there's no humanity. There's no real world um, um, not barriers. There's no real world considerations put in place um, to maximize effectiveness of something like this. I mean, this is not something you can just call up, call up, the government, and be like, hey, we have this policy, roll it out. Just announce to everybody that it's going to be rolled out. I think when it came out, people had a lot more questions than anything, because we literally had such a limited exposure to even the planning or the reception of it. So
Mhm.
it needed a lot more, and to do it for 3 years. I mean, even then, that's that's not a lot. That's not a lot of time from a research perspective to properly evaluate any kind of significant effect.
Yeah. Yeah, and the government, if public opinion was pushing the government to, I have an extra slide here, pushing the government to roll back decriminalization, I think it's really important to show that the government has a really important role in influencing public opinion. If you're going to put in a policy that is perceived to be controversial, the government has a role in contributing to combating misinformation and narratives about
Yeah.
decriminalization. And what we see from this study, I'll just quickly, and then we can go to our Q&A, um, and this is by Ali and colleagues. But essentially, they found that the majority of news articles, or 34%, sorry, I should
Yeah.
say the majority of news articles contained misinformation,
Yeah.
and that the
But
government
because
messaging,
the
yeah,
the political situation was so already so
oh no, I think we've lost Carmen. You there, Carmen?
sorry, yeah, my it dropped for me. Was that the political situation was so uh, was was as it was at the time. Of course, they were so easily affected by public opinion, so easily affected by the people who stood up and went, "Not in my backyard again." There's always going to be those people, and I really think that the time at which they rolled it out was not ideal as well, politically, because immediately, as soon as there were detractors, they were regretting it. They were pulling up their pants and running away. Um, it just it was not a politically calm time, and everyone, they were worried about other things. When really, if you're going to enact a policy like this that's supposed to be groundbreaking, or just so impactful and so worthwhile to the province really should wait until the political waters aren't so choppy.
Mm. Yeah, yeah, I think those are great points, Carmen, about being strategic in the implementation of policies like this. Our final question, and then we'll go to Q&A, is what do you both think about the future of decriminalization? Is this still something that's important to have in BC? What are your thoughts?
It isn't just like a measure that was properly done and probably properly executed, but with our political landscape right now, I don't think it will. But it's just yeah, like including youth, including like interacting with police just not be something that never ever happens. It's like a police should not be giving you healthcare advice when that shouldn't be the thing. It should be more like hiring more outreach workers or people with experience to go out in the community and help people and stuff like that. And it's just yeah, and also just helping change that narrative and educate people around what decrim is because it was so confusing for a lot of people what decrim was. So I think it's just education would be a lot better too for people to understand what it is and how yeah, how it works and stuff like that.
Yeah, I agree. I agree. Much like a lot of our, um, hopes and dreams when it comes to public policy, um, if we had all the right ingredients, um, this could be something great. It's unfortunate that, it might be one of those things that we never see again. They might never entertain again. But, and it's sad to think of what could have been. Um, but I don't know. I mean, it's still relevant. It's still a necessity. Like I said, there are places that have done it that are doing it. What are they doing? How is it working for them? What worked for them? And if we want to be progressive uh, in that arena, there are lots of their policy after ours. Um, yeah, I think that that would be great.
Yeah, yeah. I also feel like it's still worthwhile and totally agree with all of your points about how it should be designed in a better way, in a more thoughtful way. And I think it's really important to highlight how ineffective and harmful the status quo is of prohibition. We know we have decades of scientific evidence demonstrating that prohibition does not work. It doesn't reduce the supply of illicit substances. It doesn't reduce drug use, and it's harmful, extremely harmful to both individuals and our communities. So when we're reverting back to a policy pre-decriminalization, what we're reverting back to a policy is that we absolutely know has failed and is ineffective. Um, yeah, so maybe, I don't know if Kali or Carmen, if you had any final comments, and then we can see if there's any questions from the group.
No, just yeah, thank you all for coming. But yeah, it's decrim really should have been something that could have been worked out and amazing. Like it's not a bad thing that we had decrim. It's a good thing that we did, and but it's still, and a lot of people might see it as negative, but it's actually it's a good thing. Like it was a small step, like a very small step into something that could have been much bigger. But yeah,
Yeah, I agree. I agree with that. And yes, thanks to everybody who took time out of their day to come, and I'm happy to take questions. Yeah.
Excellent. Thank you. Thank you so much, Erica, Colley, and Carmen. This has been a great talk. We can move on to the question and answer period. And I do have a couple questions that have been queued up from some of our participants today. So the first question, I know you've touched on this. It was actually one of your panel questions, but I'm gonna pose it once more in case you have anything to add. What lessons do we need to take forward to see decrim adequately piloted or implemented in the future?
including people with lived experience in it, really part like every like a lot of like and from yeah, as Carmen said, all walks of life, but also just not like including the police, but not making them the go-to for healthcare advice and stuff like that.
That makes sense.
Yeah, agreed. Yeah, we need all the people at the table. We need the police, we need the health authorities, we need people with lived experience. the people who are going to be people who are going to be most affected by this, but also the people who are going to be doing the heavy lifting.
Yeah,
Yeah,
absolutely.
and I'll add one point. Is the communications plan. A communications plan should be a central component of your policy implementation, especially when it is controversial. That should really just be a core pillar of the implementation. I think if you have people in society that are unsure about decriminalization, those are the people that you want to target and educate. Because I think if you have an influx of misinformation like we did with decriminalization, those are the people that are unfortunately going to be unsure of whether or not decriminalization is a good thing. And we know decriminalization is a good thing.
Excellent. Thank
Yeah,
you. Sorry, go ahead.
I agree. Sorry, I agree with that. Yeah, we need rebuttals. We need media. We need to fight the rampant social media keyboard warriors and the propaganda machine.
Totally.
The next question I have for you, also a comment. Thank you so much for the great presentation. For reducing contact with the criminal legal system, I'm wondering if there are statistics or research on the overall rates of police charges and incidents decreasing for people who use drugs, or were they only reductions on the drug possession charges?
I think it was only
So,
drug possession charges. I can't
yeah,
remember.
Yeah, so when we talk about interact like criminal legal system, essentially the first point of entry into an interaction with the criminal legal system is an interaction with a police officer. So you need that first interaction with a police officer, and then the cascade comes from there. So then that's like formal charges, then it's courts, then it's imprisonment, et cetera, et cetera, et cetera. So the best way to look at interactions with the criminal justice system would be looking at police interactions because that's the first thing that has to happen in order for that cascade of criminalization to occur. So we do have data looking at police interactions. A lot of that is contained in the Ministry of Health reports, which we'll post links to at the bottom of this presentation. And then there's also been another great peer-reviewed study that I mentioned that also adjusts and does some statistical modeling to show that there was significant declines in incidents and interactions with police. I hope that that answers your question. Let me know if it doesn't and if there's anything that I misunderstood.
The individual did add a clarification here. So they said, I'm wondering if it's possible that while there were reductions in over-policing on the drug possession end, would we maybe see an over-policing in other areas for this population because they're so stigmatized?
We
Totally. Go ahead, Collie. Sorry.
I was gonna say, yeah, it's like it just was same. It was kind of the same footing as the police were already working. It's just like it was, they're still gonna stigmatize us, still gonna come after us. It's still a thing that's just like didn't really change at all.
Mm.
Yeah, yeah, that's it. Like I was saying, you couldn't go after people for small amounts of drugs. Well, they're going to go after people for large amounts. They're going to try and find bigger fish. Or, where as they would normally want to stop somebody for petty drug use or petty possession, now they're going to stop them for riding their bike without a helmet, or they're going to try and charge them with something else, paraphernalia, um, you know, um, possession for the purpose of trafficking. The 2.5 gram rule, that's personal supply. If they could find any other way to make that stick, make something more than simple possession stick, they would, or find a way to charge to interact with them and not make it a waste of their time. They're definitely going to put a little elbow grease into finding some reason to lay a charge on them. What I did notice also that decreased a lot was since COVID, they were really avoiding, actually physically arresting people and bringing them to jail. So a lot of times people were being issued promises to appear. So in situations like that where it was just on the street interactions for something silly and they really didn't want to bring them to jail, they just wanted to harass the person, they'd issued them a promise to appear. And the thing about that is that, of course, the Crown has to review these charges that they're going to appear on, and it gave a lot of a lot of opportunity to have those charges just thrown out from the get-go. The Crown would review it and see that there was, little to no merit, and be like, I'm not gonna pursue this. I'm not gonna pursue this.
Did you have anything to add to that, Erica? Or are we good for the next question?
I think maybe let's do the next question just because of time.
Yeah, that makes sense. Um, Thanks for this interesting talk. Wondering how they measure public drug use. How do they know that it was increasing?
Shocker,
Propaganda.
but they didn't.
Yeah, yeah,
Yeah, unfortunately, these discussions about public drug use are totally based on anecdotal evidence. So it's just
yeah,
people's perceptions of drug use increasing. And I think, I mean,
yeah,
a question, this is probably not the group of people that we need to say this to, but it's like, if decriminalization increased public drug use, which like it couldn't have, there's no mechanism, it's more likely the housing crisis. Um, has public drug use changed since decriminalization was rolled back in May? And from my perception living in Vancouver, it hasn't. Public drug use is still a thing that happens, and that's because we haven't fixed the housing crisis. We're closing OPSs downtown. Like, yeah.
yeah.
Carmen
Physically
or
knocking
Collie?
down. Oh yeah, physically knocking down. Um, SROs, closing the mods, further displacing people. I think that this perception of public drug use, this measure of public drug use, is basically just from their report of getting calls being like, "There's people outside my building smoking drugs," and and just looking on the street and seeing the amount of people out there using drugs, or people think that they might be, I, on any given day, that might look like a lot of people. If it's just say after, we had a massive housing lost for the people who's lost their houses in the fire of those SROs. All of a sudden, overnight, there was hundreds of people, on the streets, and for someone who's just getting a first look at that, or first experiencing that, not knowing that even the day before it was, nothing like that. It really is based on perception and experience, and it doesn't, it's not data that has teeth.
Collie, was there anything you wanted to jump in?
No, no, that's good.
And
Great
then
questions.
excuse me, sorry. The last question I have from our audience right now is kind of a commentary as well, but I find it very challenging that so many government decisions are based on politics instead of evidence. Do folks have strategies for trying to hold the government accountable when they make decisions that are clearly seem informed by politics as opposed to the research and evidence and lived experience?
Huh, huh. I just thought of this recently. It's funny because it's hard right now because the government doesn't want to listen. They're listening to someone that doesn't know like the downtown east side that well or drug use that well, and he's basing it off of assumptions of old medicalized stuff. And it's like we try and get her, like we used to have a really good footing with the government, like we'd have more conversations and stuff about, but they've really shut us out and it really sucks. But that's why we just do public education mainly by doing like pop-up naloxone trainings and stuff like that, just by educating the public and getting them notified, just so they make voices heard more better that way, and also just trying to, what we always say is get soccer moms involved just to try and get the word out there because it helps.
Yeah, and they say, people should not be afraid of their governments. Governments should be afraid of their people. When the masses are educated, um, eventually, if the government is so quick to listen to the loud detractors, um, with a well-educated public general public, one day that voice is going to be the loud voice that they listen to, and eventually there will be um, enough common sense in that arm of the government to back it up, or to to take it into account and listen to us, understand that, it's valuable information that we're trying to give to people.
Totally. I think like there's not much we can do as individual people, but it's so important to go vote. I probably don't need to tell this audience this, but like if you're living in Vancouver, make sure you vote in October in the municipal election because that's the way that your voice can be heard. And echoing Carmen and Collie's feelings and thoughts about soccer moms in the community. And like, I feel like it really does start with your neighbors. Like we have a responsibility as people who are educated and care about these topics to change people's minds and make friends with people who disagree with us and talk to them about these things. And exactly what Carmen said, it's the masses that will change the mind of politicians. But yeah, I echo your feelings of feeling like frustrated and disturbed. Because in the context of an overdose crisis and a toxic drug crisis that is killing people every single day, it's ridiculous that we don't have evidence-based policies to save people's lives.
Absolutely. All right. So I have no more questions online, but I did want to take the time to thank you, the three of you, so much for your time today and for all of our attendees, our participants today who joined in to listen. Thank you so much for taking time out of your day and also for sticking with us a little later. It seems like over half of the population stuck around quite late, so that's much appreciated. I am just going to throw in one last plug that we have another talk coming up in April. So stay tuned for more information on that. And thank you again, everyone. Have a great rest of your day.
Thanks so
Bye.
much, everyone.
Thank you so
Thanks,
much.
Amanda.
Yeah, thanks.
Bye.